You know, when you enter live, not some people. Some people you have to give people time when you started live.
Yeah, welcome guys, welcome. It's been a while since we went live, and I'm excited about this live to be sharing a lot of answers on the questions that have been asked previously. Karibu sana Malualo, Bawisel, Susan Brenchley, Yvonne. Hi to you. Lynette, welcome. Good to see you, people. Good to see you. Chumo, you're welcome. I'm waving back. I hope I pronounced your word correctly. Anidi official. You're welcome. Good to see you. I'm quite excited to be sharing information with you today. In fact, we should do more of this. I think I'll try and catch up with you guys more to make sure I answer to a lot of questions that I get. Watu wanauliza bei. Good to see you. Catherine joined. Welcome, Catherine. If you have any questions, by the way, you can already start sending them. If you have any questions, you can send them through over and above what I'll be discussing. Esther Rocky. Good to see you, people. Welcome, guys. Welcome, Agustodelina. Oof, guys have tough names. Vimabs joined from Machakos. Welcome. Good to see you. Good to see you, people. Catherine, welcome. Vincent Mosweta. Good to have you guys. Good to have you. We're just about to start engaging, and basically today I'll be responding to a number of questions that have been asked, and I'm taking in more questions. Chris Skywalker, what a name. Kaloti Kikuvi from Mombasa, Mtwapa. Good to see you. Karibu sana. I hope you're shaving people properly in Mtwapa. Yeah. I wonder what criteria people use to come up with their names on IG. Guys have some tough names. Good to see you, Chris. Yeah, so like I was saying, you feel free to send any questions that you might have. But I think even as we go through the conversation, we might have more questions popping up. Today you have me for the next 1 hour, ideally just to discuss hair issues is basically about hair, about the scalp. Dennis Akesi, Kahawa Sukari, good to see you. Chris Skywalker says, my name is self-explanatory, I fly. Oh, beautiful, good stuff. That's good for moving people from one point to the other. Faze Swale, you're welcome. Yeah. Yeah, Dennis Akesi. So I'll start by talking about what we do for maybe people who do not know, and then I'll tackle a number of questions that we've been receiving from people on our socials, and then we'll talk about anything else that you might want us to talk about. So my name is Muli Musyoka. I'm a trichologist, and I've been a trichologist for 11 years. I'm growing old. It's been quite some time now. And the idea is that trichology means the science of hair. So tricho is hair and ology is the science behind hair. And trichologists are specialists who handle hair and scalp conditions. So we treat hair and scalp conditions, because of course your hair grows on your scalp, and anything that is bad for your scalp is bad for your hair. Welcome Ronnie, Jenny, I can see all of you. I'm happy to be having you. So I trained as a trichologist in Australia and started practicing in 2010, but I opened my practice, which is Hair Hub Trichology Center, back in 2014, and we stop hair loss in many different ways. We do things like hair transplant. We do use of growth factors from your own blood to stop hair loss and thicken hair that's growing but growing thin. But the most important when it comes to any form of hair loss is really not just jumping into things to sort out the hair loss, but really understanding what is causing the hair loss. Why am I losing hair? When you look at different conditions or different hair and scalp conditions, your hair is related to a lot of nerve endings, and any hormonal changes in the body system will actually be recorded on your hair. Good example is someone who was poisoned. The hair deposits protein with every growing day, and that's why you can actually use hair to tell if someone was poisoned and when they were poisoned, because we know how quickly the hair grows, or the hair growth rate in a month or in a day. And that can actually be used in forensics to determine when someone was either poisoned, or if there are an influx of certain minerals in your body, you will have less of the same on the hair, or the vice versa. And your hair can actually be used to say if you have any deficiencies of minerals or you have an influx of the same. So someone was asking me, how can I regain my hairline? Because I assume this is someone who is losing hair. They didn't give me their name. But there are quite a number of things that are leading to loss of hairline recently, and what I've seen a lot in the clinic. Of course, this is not conclusive, but majority of the ladies we're seeing are losing hair to either tagging, which could be caused by anything like braids. It could be caused by anything like weaving, or very tight cornrows, or wearing very tight wigs that ladies would fix on. So if it is very tight, then it will end up cutting your hairline. There are other conditions like autoimmune problems. We have a problem called frontal fibrosing, which is a stress-related form of hair loss. And this must, the person suffering from frontal fibrosing will have an underlying situation, or we call them autoimmune problems, that they were born with that problem, and then it takes something to trigger it. For instance, any form of stress. It could be you're on very strong medication, or you were very sick and the body went under a lot of pressure that it couldn't handle. Then you start losing hair on the front hairline. And this is an idiopathic activity of the white blood cells, when your white blood cells turn against your hair cells and start attacking them. So that could lead to loss of hairline. Both men and women would suffer from a genetic hair loss. We call it androgenetic alopecia. And alopecia simply means hair loss. So that genetic type of hair loss then would lead to recession of the hairline or hair loss on the hairline. That could be something else. So for me to be able to really tell what you need to do to regain your hairline, we need to do two things. First, establish exactly what is the problem, what is the diagnosis, what is making you lose your hairline, and to what extent is the damage. Is it just thinning, or have you lost hair follicles, or is it just breakage? Once we establish that, then we come up with the best therapy. If you've lost hair follicles, then our chances become very limited. Our options rather become very limited, and we're left with the option of replacing those hair follicles with other hair follicles. If you still have hair follicles growing, but you're experiencing breakage, then it's an issue of hair maintenance and encouraging hair growth in those particular follicles. You can do that with supplements. You could do that with topical creams that will encourage hair growth and stopping whatever was causing that breakage. And generally, proper management of your hair could help to keep that. So it's important to establish what is causing the hair loss and to what extent is the damage, because then and only then we can come up with the best therapies to sort that out. How can I achieve such a hairline without surgery? And I think this was stuff after we posted an image of a gentleman who had lost hair on the forelock, and we did a transplant for him, and in 11 months he had very good growth. So I think this person is asking, how can I achieve my hairline without surgery? And like I've said, again, it's dependent on what is causing the hair loss and to what extent is the damage. We just don't do surgeries or hair transplant for everybody. It is the need. If you've gotten to a stage that the hair loss, there's nothing much you can do. You have two options: to stay with the hair loss as it is, or to, if you have a proper donor site or safe zone, then to harvest hair follicles and graft them in the area that you've lost hair and replace that. So dawa ya kumeesha nywele haraka. I think what you're asking about is something that could accelerate hair growth. And to be honest, we have quite a number of things. If your hair is growing slowly because you have a certain deficiency, you have low levels of vitamin D3, for instance, or your iron level is questionable, you might see your hair shedding off, or your hair doesn't grow in length. So one of the things, if that is a problem, then you need to fix that. There are topical creams which are approved by FDA. We have things like minoxidil. But I would suggest do not prescribe these things for yourself, because again, hair loss is just like any other form of condition. If you have a problem, you want to get a diagnosis fast, otherwise you'll be shooting in the dark. So we have topical creams that you can apply to accelerate hair growth. They are called vasodilators, or they increase blood flow on a particular area that you apply them. So they can thicken your hair. Those men who are very thin beards, you can use minoxidil to try and thicken it, as well as people who are thinning. However, I wouldn't encourage the use of that on genetic form of hair loss, because then it's a very temporary solution for genetically thinning hair. You will apply that, and over time you start losing the benefits if you stop using it, or if the body gets used to it and is stretched to the extreme limits and then just stops responding to the topical treatment, and then you start losing hair much faster than you really were. The other thing would be, for instance, we use things like platelet-rich plasma, which is the use of your own growth factors, and I'll talk about that later before I finish. Really to encourage growth of hair, and this is the use of your own growth factors to accelerate multiplication of hair cells and to increase hair growth. Yeah. So I'm seeing people like Alex from Uganda, Wairimo. So please keep sending your questions. We are putting them down, and I'll be responding to them. If I'm too fast, please raise your hand and say, Muli, go slowly. I tend to speak quite fast. So I am surprised that my hairline can be affected when my wig is tight. Yes, of course, anything that is tight, capes, anything will lead to hair loss as long as it's tight. Guys, don't confuse. If you're losing hair in a genetic manner, it's not because you wear capes every other day. People used to say, nikivaa kofia sana nywele yangu inapotea, ndo maana nimepata kipara. I mean, yeah. What your take on RUF8 and minoxidil. I think I've been talking about minoxidil and RU58. These are vasodilators. They just increase blood supply on the scalp or wherever you're applying them, and they are quite temporary, particularly if you're using them for hair that is genetically thinning. However, you can use them to thicken other parts of your hair, like beard. Men who want a thick beard, you can use that to encourage hair growth in that particular area. Yeah. Casey, please don't be that for you. I don't know what you wanted to say. I think he's telling the lady who was asking about the wig. He's telling them don't put on the wig tightly for sure, because it will lead to hair loss. I got another question. Do you have any advisable treatment of premature graying? Now, if your hair is, I don't know what you mean by premature graying, by the way. If you're 12 years, yes, that's premature graying. If you're 13, 14, 15, that's premature graying. If you're the age of 25, 26, 27, 28, and you're starting to get gray hair, then please, it's not premature graying. However, the thing is, there are things that could accelerate the loss of hair, graying of hair, and some of those things would be stress levels. Things like excessive smoking, because it vasoconstricts the capillaries, and then it slows. You don't get enough of production of melanin that is supposed to color your hair. However, it's not abnormal to get strands in different places where they're silver or they're gray. It could be genetically you're predisposed to start graying hair earlier. However, like I said, there are things that will accelerate that and make that happen faster or earlier than it was supposed to happen. Young kids, I said 12 years, for instance, if there are some deficiencies, things like copper are very important for the generation of hair cells. We drink water from the pipes, and if you drink a lot of copper, then the body would stop production of copper, and copper is very important for the generation of melanin, and that could actually affect hair gray. Or there are some other minerals, if kids are lacking that, we could see them having gray hair. Yeah, please keep sending your question. We are following them up. And Jenny Mboro asked, I am losing my hairline, especially on the right side. What could be the problem? Wow, Jenny, it could be quite a number of things. It could be either you're tagging your hair or pulling your hair. I think at the beginning of the live I said it could be an autoimmune problem. It could be braiding. It could be if it is on the side, it wouldn't be genetic, because genetics will only affect the area above the occipital bone. It could be you're tagging it. Either you're wearing something very tight like a weave or a wig, or your very tight cornrows. For young ladies, if you have tight ponytails, that's good enough to pull out your hair. Or if you braid a lot, and it's not only braiding, if you braid tightly, I think I should clarify that. So unless we clearly see what's happening and we have a proper conversation around it, I might not be able to exactly say you're losing hair because you're braiding, or you're losing hair because you sleep on that side, or it could be anything. Yeah. Please keep sending your questions. Good to see you, Miriam Makeba. You're welcome. Maclina Koth, waving back. Is hair drying necessary for relaxed hair? I have noticed that I shed more hair when I think they wanted to say is air drying, not hair. Is air drying necessary? You need to understand that I'm Kamba, so hair and air, please. So it's air drying necessary for relaxed hair. And I've noticed that I shed more hair when I air dry than when I use heat, like say a hood dryer. Which one would you recommend? To be honest with you, if you want to naturally dry your hair, if you have relaxed hair, you shampoo it, you treat it, you can put it in like loose double twists and allow it to dry naturally. That should be okay as long as you put a moisturizer in the hair. You shampoo the hair, you treat it, and then you moisturize it before you do either the double twist, or you can do the matutas and allow it to dry. Putting it under a hood dryer, using heat to dry your hair, as long as it's either stretched in a particular way, either you've done roller setting on it, it should be very okay as long as you're using the right heat. Don't use too much heat. I think that should be the key thing. So you can dry it either way as long as it works for you. Faisal Nyambo, you're asking which hairstyle would you recommend? Faisal, for which occasion? Your hairstyle is about occasions. Could you kindly elaborate a little more, Faisal, on what you're referring to? Please keep sending the messages. And if I could go back and talk a little bit, I'm losing my hairline especially. Okay, I think I've answered that. Yeah, so I think that's okay. I spoke about minoxidil. I'm surprised that my hairline can be affected. I think I responded to that. Thank you. Okay. I have a receding hairline, especially on the, I think I've shida iko wapi. Jenny, tumesema hiyo shida itabidi tumeiangalia ndo tujue exactly where the problem is. Otherwise we might not be able to land on the exact problem. Is hair drying necessary? Okay, I think I've responded to that. Kirigo, Chris Kaboga joined, good stuff. All right, so I was talking about things that could accelerate hair growth, or things that would make the hair grow fast, and I mentioned use of growth factors. And we do something called platelet-rich plasma, or PRP, platelet-rich plasma. And this has been one of the revelations that has been gotten into the hair industry with a lot of success. And ideally, the use of growth factors has been in the world for many years. I think since 1954, that was the first time that growth factors were used to help treat low levels of red platelet count. And later on, orthopedics used it for maybe athletes who would have problem with their joints, or they got injuries. Boxers get a lot of injuries on their shoulders, so they would inject growth factors on the knees. And it really helps with something we call collagen renewal. Growth factors help the body to renew itself. And now we're using that to help in regeneration of hair cells, to halt genetic thinning of hair. And not, I said, to halt, not to completely stop, because something that is genetic, we might not be able to permanently stop it from ongoing. At the moment, we do not have a technology in the world where we stop progression of genetic hair loss permanently. But we can halt and manage that condition, so that means we manage it so that we stop it from progressing as long as we do something. And how we do PRP is that we harvest some small amount of blood from the patient's arm, and then we centrifuge it at a very high speed. Separates all the blood components, and they look different. You'll have your red blood cells at the bottom because they're quite heavy. You'll have your white blood cells, and then you'll have a suspension of platelets. And platelets carry growth factors in the body system, and they carry healing effect in the body system. So what we are looking for are specifically two growth factors. One is called we have something we call follicle derivative growth factor, and then we have the transforming growth factor, which really helps in your hair needs transforming growth factor to move from the growing phase to the resting phase to the shedding phase, then to the growing phase again. And the follicle derivative growth factor helps with the generation of hair cells. And that's why we harvest blood, we spin it, we get the platelets, and then we have a machine that deposits that on the particular area that's thinning. Or for instance, if we do hair transplant and we want to accelerate the process, then we deposit growth factors in the area that we've transplanted hair. And what happens is that the high content of growth factors will accelerate multiplication of hair cells and ensure that you're producing good quality hair cells. And that's how we get your hair growing faster. I was talking about that because someone was asking, how do we, what can we use to accelerate hair growth? So those are some of the things. You can use supplements. Again, if you have a deficiency, it's very important to fix that deficiency. And if you run a test and realize I'm low on vitamin D, and you get on vitamin D, for instance, 60,000 international units a week, you have to be on a certain dose, and after that period, then it is wise to go back and run the test again and see, did you achieve whatever you wanted to? Have you corrected the deficiency? Because sometimes you could be having a deficiency, you're on the right supplements, but then the body is not absorbing that. So if the body is not absorbing that, then you will need a carrier to take it together with the particular supplement that you're taking to make sure that then you achieve what you want. Yeah, so please keep sending any questions. Anyone with any questions should be able to answer that. If you had a question and you didn't feel like I answered it satisfactorily, please make sure that you ask that again. I'm seeing people from Portugal. From Portugal, you're welcome. Any questions? Any Mboro? I think I've responded to that. Faisal, please clarify on the question about hairstyles so that make sure that I answer your question. Do you do eyebrows too? Yes, we do eyebrow transplants. And again, if you're losing eyebrows to autoimmune problems, then we can mitigate that and make sure that you don't lose your eyebrows. Remember, there are hair loss conditions. We have a condition called alopecia areata. What happens is, alopecia areata is an autoimmune problem where white blood cells attack your own hair stem cells. Now, the white blood cells do not attack your hair follicles in this particular case. They attack the hair stem cells. What that means is that your follicles will remain intact. And once the trigger stops, then you should be able to get the hair growing. The trigger could stop on its own, the body could overcome it, or you could do medication that helps to stop that problem. So, alopecia areata can affect any part of the body. You can lose eyebrows, you can have hair loss on the eyebrow, you can lose your beard, or you can lose armpits or pubic hair, or you can lose hair on the scalp. Now, in severe cases of alopecia areata, people get patches on the scalp and then they coalesce or they join. And then when they join, you lose everything on the scalp. It's called alopecia totalis. And in very severe cases, then you lose you lose everything on your body, and that's called the alopecia universalis. So that's when you can actually lose everything: your eyebrows, your eyelashes, your eyebrows, and you'll notice patients who have lost hair to that will have eye allergies, because hair is so important that eyelashes protect our eyes so much from dust, from particles and all that. So the moment you do not have your eyelashes, then your eyes will be in trouble. So alopecia areata could lead to loss of eyebrows. But where we do hair transplant is in situations like people have been tweezing their eyebrows so much that their eyebrows suffer what we call traction alopecia, or you pull out the root, you yank out the root. Is the same thing as braiding. So in such situations, we tend to do hair transplant for the eyebrows. Yeah. Dandruff, what the cause, the main root. Now, I know most people say I'm having dandruff when they just have a dry, flaky scalp. Maybe because they are not, particularly men will use a lot of soap on their hair, and soap is not so good for your scalp. Again, if you shampoo your hair too often, or you're not moisturizing your scalp, or you have conditions like hypothyroidism, you could have a very dry scalp, or you have some deficiencies like zinc, lack of zinc in the body, you'll have a lot of shedding of the skin. However, dandruff is a condition that is brought about by I'm trying to remember the name of the bacteria that really causes dandruff. I'll remember it, but it's Malassezia globosa. Malassezia globosa is what causes dandruff, and it feeds on oil. But it's a condition that most people are predisposed to that. So if you do not manage your scalp properly, if there's a lot of tagging, a lot of buildup, if your scalp is not clean, then you might end up having dandruff. And some of the dandruff are so oily and stuck on the scalp. And one thing about dandruff is that it could be very smelly. But mostly we have dry dandruff and we have oily dandruff. Mostly you'll see people with a lot of shedding of particularly Asians, they tend to have crazy levels of dandruff. So it's really just managing the scalp properly, and making sure that you shampoo your scalp properly, and you can use some medicated shampoos to really take care of the Malassezia globosa just for a short period of time, and then you resume to your normal. Make sure that your scalp is moisturized. If then your dandruff is the oily one, then you need to avoid oils. And the other thing is your diet. You need to make sure that you're not you're not staying on a very oily diet, and that would help to reduce the problem. So the main root cause of dandruff is Malassezia globosa, which feeds on oil and multiplies. Okay, Sony Kamau, you're welcome. Essie, my hair grows unevenly. Side and back grows very fast, but the middle section does not grow. So I keep short hair. How can I get the middle section hair to grow as much as the rest of the hair? Now, this sounds very, very familiar. Essie, sorry to hear that your hair is not growing. My understanding is that you're saying the sides and the back grow very well, but the middle area is a little bit retarded growth. Now, I do not want to make a conclusion, but however, from your explanation, my first question would be, are you going through female pattern hair loss, which is kind of a genetic hair loss? Well, not kind of, it's genetic hair loss. Because if you look at men, when men go through male pattern baldness, they lose the top area, but the sides and the back looks very healthy, because we call that area the safe zone. And the reason is that the area below the occipital bone, the kisogo, that area below that is resistant to hormonal changes in the body system. The follicles above here have a receptor molecule for a male hormone that is responsible for genetic hair loss. So when you're going through genetic hair loss or female pattern thinning, chances are very high that your safe zone will be looking very healthy and grows very fast, and this area will be retarded in growth. That could be a very early onset of that. And the key thing is, I really can't tell you do this, because I would encourage you to have it checked. Just have it checked. If you know a trichologist near you, I don't know where you're writing from, but if you're in Nairobi, you can always pop in. We have a look at the situation, because we need to establish, is it exactly female pattern thinning, and to what extent is that? And please note that hair loss, the earlier you treat it, the better. Hair loss, the earlier you treat it, the better. If you let it go on and on and on, it becomes tough. Yeah? So please, Essie, make a point with Hair Hub. Come over, we have a look at it, and we make sure that your hair loss does not continue. The earlier you treat it, the more chances you have to regain your hair. Okay, Dokatari. Someone is Lucy Wakingori is calling me Dokatari. Kindly shed light on the scalp exfoliation trend I've been seeing. To be honest with you, Lucy, I don't know what to say about scalp exfoliation, because I've been seeing it in salons. When someone goes to the salon and they have hair loss, then guys tell him that him or her that your follicles are clogged. I don't know what that means, to be honest. I don't know what people mean when they say the follicles are clogged, and that you need to do exfoliation and that your hair will grow. Well, massaging the scalp could increase blood flow, which is a good thing for any part of the body to have sufficient blood flow. Unclogging clogged follicles, scientifically, I don't know what that means. So I wouldn't say go and do exfoliation. If someone has some explanation that could help, I would actually invite them to share. You can share, but for me, I wouldn't do scalp exfoliation, because scientifically, I don't know what I'm trying to do with that. But we can massage the scalp, increase blood flow, keep the scalp clean. If you have follicles, they should be able to produce hair. When we say clogging, to be honest, I don't know what it means. Sorry, I couldn't answer that sufficiently. Yeah, so Virginia Kinuthia, how many months, this is a question from Abdullahi, how many months of the year does your hair regrow if you have alopecia? How many months of your hair? How many months or years does your hair regrow if you have alopecia? Well, it depends with what you're doing to restore the alopecia. For instance, I've seen kids who have lost hair, who have gone through alopecia areata because they were going through an exam period, and after that their hair just automatically grows back by itself. There are people who will have the same problem and it will take them years, really. Like today I was seeing a patient who came to see me the first time in, I think, September 2019. He flew in from Canada, and he was on H. pylori medication, and he claims that he took the medication and took sleeping pills because he knew it's going to be a long flight, and he slept on one side of the scalp, and I think it was the right side, and that is the side when he landed in Kenya and he had lost a lot of hair on that side. How true that is, I don't know, but what I know is that I saw him and he had alopecia areata. The fact that he was taking a H. pylori medication means that he had ulcers, because ulcers is caused by H. pylori. That by itself, or whatever was giving him ulcers, could actually, the ulcers itself could actually lead to loss of hair. The medication itself could lead to loss of hair. And then he said the medication was expired. But this guy, he had lost hair in 3 major patches of the scalp, and we've treated him. He's gotten full growth apart from a small patch at the back, and that's what we're trying to do. So that has taken 3 years. So every case is so unique. When we do hair transplants, we say the average numbers are a year. In 6 months I expect 50% growth. In a year we expect to get full growth. But some people take 18 months for them to get full growth. Others will get full growth within 8 months. So it's very dependent on every patient, and we treat every case separately here at Hair Hub. Samantha Akunda, Misiki, Cynthia, good to see you people. Renchin-san, Bistivo joined. Good to see you. Please make sure you ask. Olga de Prosa, your question is, does all the women go through hair fall after postpartum? And the answer is no. No, it's not a must that every lady will go through hair loss after postpartum. For those who will not understand, it means that postpartum alopecia is hair loss after childbirth. And most people will say, I'm losing hair because I'm breastfeeding, or I'm lactating mothers will lose hair. But what happens is that estrogen or female hormones are very good for hair. So when ladies are expectant, the hair stays longer in the growing phase, so they have very thick hair and all that. When you deliver, what happens is that then the hormones drop back to normal, because the body realizes, oh, we're producing too much of this, so we need to drop back to normal. And that fluctuation itself triggers a shock in the body, and hair will register that. So the hair loss that we experience 3 months is because of the fluctuation of hormones that happens during delivery or after delivery. But why does it happen 3 months later is because the hair takes 2 to 3 months to move from the growing phase to the shedding phase. And that is why the hair loss happens 3 months when you're already lactating, but it doesn't mean that you're losing hair because you're breastfeeding. But to answer your question is that not everybody will suffer from postpartum alopecia. I am from Uganda and would like to come to you for diagnosis, but I need to know cost implication for a consult before I travel. Yeah, so from Uganda, if you travel, I think consultation would be 3,500 Kenya shillings. What is that in dollars? It should be $35. $35 is consultation. Yeah, $35 is consultation. I'll have my team talk to you, AC, so that they just share, give you more clarity on how we can, you can come over, you can get an appointment, so that we make sure that we've helped as much as possible. Masinguli, good to see you. Jenny Mboro says, I suffered alopecia areata and it took me a whole year and some change for my hair to grow back. Yes, and this is just to reaffirm what I was saying. You cannot say that if you're going through a certain form of alopecia, it grows back within a month or it grows back within 2 years. I think everybody is quite different, and it's only fair to handle every case separately. And again, for instance, if you're going through things like alopecia areata, whatever is causing it, because there could be a trigger that's still ongoing. If the trigger is still ongoing, then it will be tough to stop it. So the most important thing is really to identify the trigger, address the trigger, and then the hair loss will be resolved. Hair is just a barometer of what is happening in the body. So if you see yourself losing hair, it means there's something that is underlying. That it's just a sign that you need to address something. Okay, there are a lot of versions about this topic. Thank you for the answer. Wow. Please share a little. Let me see if I can track what was your question. Does all women go through hair fall after postpartum? I think that's what you're saying. There are a lot of versions about this topic. I don't know. Could you share what you think about it? AC, is it okay to wash my hair daily? It is as short as yours. Yeah, if your hair is short as mine, like I can see on your photo, AC, you can wash it every day, but don't wash it with soap every day or shampoo every day. Avoid soap on your scalp and hair. What you do is you shampoo your hair once a week, then you can treat it, and then the rest of the day is just splash warm water when you're showering, but avoid any soap or any form of shampoo. Don't shampoo your hair every day, because then you're not giving time to sebum to do its work. Your sebaceous glands produce sebum, and sebum mixes with sweat to create something we call mantle acid, and that is what makes protect the scalp from bacterial infection, being very dry. It helps your hair to stay moisturized as well. So if you shampoo your hair too often, and particularly for Afro-ethnic type of hair, because our hair is so curly, it takes time for the movement of oil from the root to the tips. So if that happens, then it becomes a little difficult and the hair will be dry. So just shampoo it once a week, treat it. The rest of the day is plain water, then you can moisturize it. Shimagi joined, good to see you. Guys are still joining. Good to see Bookie products. We appreciate. Yeah, unless there's any other question, the picture below. Okay, cool. I have a question about itchy scalp and dandruff. Do you have products that can help cure? I think if your scalp is itching, number one, a dry flaky scalp will be itchy. So what you need is to moisturize it. If someone is going through, for instance, female pattern thinning or genetic hair loss, they will have an itchy, tender scalp, and that would mean that they will need to get that sorted, because that's an internal problem. Again, you cannot treat it topically. So it's not always, guys, what I want you to understand is that there is no this one magic product, because most of the time I see people writing to me and asking two questions. People will always ask, how much? I mean, just someone writes and says, how much? So you ask them, what? And they say, how much do I need to stop hair loss? When I don't know what hair loss it is, you really need to establish to what extent the hair loss is, and only then you will know what therapies will be successful or will be best suited for that particular condition, and then that will be different. There is no one price point for everything. Number two, people always ask, what product can I use to stop hair loss? Again, what hair loss? To what extent is the hair loss? Because you could be going through the same problem as someone else, but the extent of the damage is different. So you will be on different therapies. At the same time, you could lose hair like someone else, particularly maybe in the same pattern, but the causes are totally different. So itchy scalp, if you have dandruff, if for real you have dandruff, a condition called dandruff, then you can get some medicated shampoo and use it for like 2-3 weeks. It should be able to clear. Keep your scalp clean, keep it moisturized. Don't use medicated shampoos again for too long because they have metallic salts, and what that will do is it will bring a metallic salt build up on your hair, make it very dry and scalp very dry, and could actually worsen the flaking. But before again, I just want to clarify that most of us call a dry flaky scalp dandruff, and dandruff is a condition triggered by a bacteria we call Malassezia globosa. So it's not every flaking that is dandruff. Again, one of the things that hugely confused for dandruff is something we call psoriasis, because it's a flaky condition and you get these thick flakes that build up in patches, and mostly they affect the hairline and behind the ears. They are stuck, and when you lift them you could actually see some little bleeding, and these are autoimmune problems that need to be treated internally, though some topical creams could help. So it's not every flaking that you see would be dandruff. The other thing is dandruff would possibly cover the whole scalp. So if there are patchy flakes, then you would want to have that checked and make sure that you get the right solution to that. Let me see if I have any outstanding question. How can I regain my hairline? I think I'd answered that. Yeah, so unless there's any other question, does all the women go through? Okay, I think I've answered that. I suffered alopecia areata. Good. A lot of versions to that. Anyone with any questions? As you can see, I'm still in the office. I'm about to shut down and go home. It was amazing hanging out with you guys. Best hairstyles to avoid receding hairline. Oh, Faisal, you're back. Okay, see now you've asked the question. Good. So, braiding is not bad at all. But how do you braid your hair? Number one, make sure you don't braid your hair for... I remember Kitambo some time back, people used to do braids, and then after 3-4 weeks you go do repair and and then they'll be so tightly secured. Please avoid securing your braids so tightly. If the person braiding you cannot understand what you mean by that, please move on, because it will be very expensive to restore your hairline. Avoid tight comb rolls. Avoid very tight wigs. It doesn't mean that you cannot put on a wig, but make sure that it's not tight. And then the other thing is, don't put it on every day. Those amazing weaves and wigs that are long and looking nice and all that, they are so heavy on your hair that anything that is heavy, it's tagging your hair even more. And we clip them on our hair. So you're really straining your hair. And because inside the hair follicle has something we call the inner root sheath, which are hooks like this. I'll call them hooks. And then the hair strand has the outer root sheath. So they interlock. They are cuticles that interlock. And that's why when you pull your hair, it's actually painful, because it's firmly held in the skin. So if you keep straining it, you dilate the skin and you pull out the root. And once you lose the root, then it's gone. It's permanent hair loss. So any hairstyles that you want to do, like you want to braid your hair, make sure you don't braid for more than 3 weeks. And make sure that they are not tightly secured. Even ponytails, make sure your ponytails are not tightly secured. If you're putting on extensions, make sure that they are quite light and they are not tightly secured. Then make sure you treat your hair, give it a break. If you've been doing, I hear people calling them protective hairstyles, but they're doing more damage than protection. So make sure that at least every month you've if you add, for argument's sake, braids on for 3 weeks, remove them. Take another month or 2 months of shampooing your hair, treating it properly, keeping it moisturized. That will keep your hair in place. All right. Does the stress affect also dandruff? Yes, stress will actually worsen any condition on the scalp. Stress is not a friend of the human being, or makes it worse. Yes, it will affect. It makes it worse. It worsens hair loss. it would worsen scalp conditions. Some scalp conditions, flaky scalp conditions like psoriasis, are stress related. Nwahusi says, my hair was thinning before I was diagnosed and given supplements. How long should I take them? Whoa. I wonder what was causing it to thin. I wonder what the diagnosis was, and what the doctor or the specialist was trying to achieve with the supplements. That's a tough one for me. However, I would say this: do not take supplements throughout for more than 6 months. That would be too much. What you'd want to do if you're taking supplements, because mostly people prescribe supplements for themselves, is essentially you'd want to take supplements for 3. If there was a deficiency, you'd want to take supplements for like 12 weeks. That would be like 3 months. Yeah, 3 months, and then you can run a test and check if you have an improvement or the situation has corrected itself. If the expert told you to stay on supplements just to sort hair thinning, although I don't know what exactly hair thinning was, probably after 3 months you'd want to engage them again and see if the situation has improved, or if you feel the situation has improved, then I think that's okay. But if you want to stay on supplements, it's advisable that if you take them for 3, 4, 5 months, give yourself a break. You can take a break of like 2 months, because again, the body should be able to produce most of these elements that we get. Dr. Fitness, you're welcome. Good to see you. Supplements are actually improving the hair density. Yeah, that's a good thing. That's a good thing. So you can take them for a period of time that you will see you're getting the density that you want, and then you can take a break, and then later on you can get back and use them a little bit more. I am Miss Marilyn. Welcome. I've noticed that whenever I use hair products containing alcohol and sulfate, what causes this? Also, whenever I wear my hair down, I develop rashes around my neck. Why? Okay, I think Esther, you had asked something earlier. Will I be able to trace it, because you've asked a continuation of the question? Let me see if I'll be able to get it there. A lot of versions. Okay, I don't seem to be able. I've noticed that whenever I use hair products containing alcohol, let me answer this. Or sulfates. Well, I don't remember the first question, to be honest. But sulfates are salts, and alcohol will drain oil and moisture from the hair, so it renders the hair dry. Same as sulfates, and that's why you see nowadays everybody's putting together shampoos and says it's sulfate free, though some of them are claims that are actually not true. But sulfates, high level of sulfates or poor quality sulfates. Why do we need sulfates in shampoos? Because for you to clean your hair, you need a cleaning agent. We call it surfactant or detergent, and detergents or surfactants are made of salt. So some of the shampoos, people will just put either poor quality sulfates or high levels of quality sulfates. High level of sulfates to really just do the job. But sulfates will drain oil and moisture from your hair, same as alcohol, and that could actually dry the scalp and make it itchy as well. I hope I've answered that. Also, whenever I wear my hair down, I develop rashes around my neck. Why? Probably you're using a product that your skin is reacting to. So once your hair gets into contact with that, then you could have a rash. Or if you're wearing hair extensions, it could be weaves, it could be wigs with synthetic ones that will have an ingredient that then your skin is reacting to, that could lead to that. The rashes. Do you ship trichotillomania products? How can we access them out of Kenya? Yes, in Uganda we should be able to send trichotillomania products to you. And for those who do not know, we have a hair care product called trichotillomania, which is we have a shampoo, we have a treatment, we have a moisturizing cream. ideally we were looking at making sure that we sustain the integrity of hair. We have a shampoo that really takes care of the hair, because most of the people have dry, flaky scalp and poor quality hair that has lost its natural color because of number one, the shampoo that they're using. If the shampoo you're using is too harsh, you're already damaging your hair. So yeah, we have this range of product called Trichotillomania. We will share more information on our socials, but yes, we can ship it to Uganda. Essie, I'll make sure that we talk to you, my team talks to you, and we see how we can help you get that. Yeah, so for those who are joining, my name is Muli Musyoka. I'm a trichologist from Hair Hub Trichology Center. Hair Hub Trichology Center is in Nairobi, Kenya. My name is Muli Musyoka. I'm the lead trichologist in the clinic. Yeah, and we treat hair loss, we treat scalp conditions, we were the first people to do hair transplant. In fact, Hair Hub was the first hair restoration clinic in sub-Saharan Africa when we opened up. And Muli Musyoka was the first trichologist in sub-Saharan Africa in 2010. Yep. Of course, we have now quite a number of other trichologists we work together, and we are happy to do that as long as we get you helped. Yeah, any other questions? Let me see if we have any other questions. Yeah, Faisal, what products would you recommend to retain hair? What products would you recommend to retain hair? Faisal, to retain hair. Just make sure you manage your hair properly. Shampoo it with good quality shampoos once a week. Worst case scenario, 2 times a month. Make sure you do proper treatments. You need a treatment that gives you moisture, it gives you protein. You cannot sustain your hair by giving it moisture. It means that the hair will be moisture, lustrous, but it will be weak. And you cannot survive on protein. The hair might not be breaking, but it might be very dry. So you need to alternate or get one product that does both for you. So it's important that you sustain that and avoid the hairstyles that will take your hair away. Eat healthy, make sure you get enough iron, make sure you get enough vitamin D, very important for your hair. Stay less stressed. Stress is not a friend of your hair. Yeah, again, I see people asking my name. My name is Muli Musyoka. Muli Musyoka is a trichologist at Hair Hub Trichology Center. Sent a request to be in your live video. Yeah, someone wants to come into my live video. Let me see if I can get you on. My client happened to be losing hair in round-shaped pattern. What could be the cause? Yeah, probably there are quite a number of things. There's a problem we call trichotillomania, where people pluck their own hair, and it's like a psychological problem, so that you could lose hair in oval patches, and the thing is, you will get a lot of hair breakage. You'll of course have a lot of stabs on the scalp rather, because then you break off the hair at the root. People pull their hair, and in very severe cases they eat the hair, and they end up having a problem we call trichobezoas, where the hair creates balls in the stomach and they have to go through surgeries to remove that. However, again, patches, if they are very clear patches, there's a possibility that it could be alopecia areata, which is a stress-related condition. So please make sure that you have them checked by an expert and make sure that the hair loss does not continue. And particularly, Kaloti, I think Kaloti is a barber, yeah. So make sure that your client doesn't lose all the hair and you have no hair to work on. Yeah, so get them checked. It could be a stress-related form of hair loss. Alopecia areata, if the patches are very clear, it's a possibility. We have other things we call lichen planopilaris, which is also an autoimmune problem that could also have someone lose hair in patches. So usually you'd want to have it checked so that we don't shoot in the dark before we start sorting it. Nausi, how can we protect hairline from breakage? Avoid anything that pulls your hairline. Make sure you do not wear your hairstyles tightly. Make sure you don't wear your capes very tightly. Keep your hairline moisturized. Treat your hair properly. Keep away breakage. Yeah, we have 3 minutes guys before we close down. Hello daktari, niko na problem ya scalp. Je, inawezekana kupata matibabu ukiwa mbali? Yeah, I think the key thing is Chanzak. Yeah, we can actually talk to you. We should be able to get in touch with you, see where you are, see what's happening, and we see how we could help. Once in a while we do virtual consultations, though we might not be able to really settle on a diagnosis, so we do not encourage a lot of virtual consultation because it will be not accurate diagnosis. And if you want to treat something properly, the most important thing is really to get the diagnosis properly. If you're in Tanzania, we have a lot of patients from Tanzania, so inawezekana tunaweza angalia shida iko wapi, tutakuongelesha, and then we see how to get that sorted. Yeah, so we shall write to you as soon as I'm done with this live. Yeah, is there a kind of diet that can help to maintain strong and healthy hair? Yes, balanced diet. Your hair is made of a protein material called keratin, so you need protein. In fact, if you stay away from protein for like 15 days, you should see the impact on your hair. You need iron. If you're lacking iron, we see people losing hair diffusely. You need vitamin D. You need everything. You need a balanced diet to keep your hair growing and growing healthy. Yeah, Kesmash, it's unfortunate you seem to be joining at the end. So thank you very much, guys. I really appreciate it. It was amazing spending time with you. Again, I repeat, we are Hair Hub Trichology Center. My name is Muli Musyoka. I'm the lead trichologist in Hair Hub. We treat hair and scalp conditions, and we would be happy really to help sort out any challenges that you have. The key things I said, if you will forget everything else I said, is hair loss. The most important thing is to get a proper diagnosis, know what is happening, and to what extent is the damage. Only then is when you can come up with a proper formulation of therapies to help restore the hair and stop any further hair loss. The other thing I will say is hair loss, the earlier you treat it, the better. So if you notice that you're losing hair, the earlier you treat it, the better. Don't wait assuming that hair will grow back on its own. It won't. And if it does, then you're lucky. So make sure that you address your hair loss in good time, and we should be happy to help. Please follow us on our social medias. We are on Instagram, we are on Facebook as Hair Hub. I can see someone asking me to do this weekly. I'm not very good, but I'm promising, yes, we will actually try and do this more often, so that we make sure that we answer all the questions that you have. If you have any questions, send them already on our socials, and we will, next week I should be able to sit down and respond to those questions and answer any other concerns that you may have. Or we were lucky today. No, you are not just lucky today. I will make sure that we do this more. Thank you for the session. Thank you so much, guys. I will miss you. Enjoy your evening. Take care. Get enough rest and be ready for work tomorrow, and see you again next week.